All right, well, we'll go ahead and get started. I wanted to say hello and welcome to the Hawai'i Health Data Warehouse's Coffee Break monthly webinar series. I am Julia Chosey, one of the public health epidemiologists with Hawai'i Health Data Warehouse, or HHDW, and research faculty at the University of Hawaii at Manoa. We're going to use the next 30 minutes to introduce you to the Oral Health Data Tracker on Hawai'i Health Matters. Let's get started. The Oral Health Tracker was funded by the Hawaii State Department of Health and brought to you by a partnership between the Hawaii Oral Health Coalition, the Hawaii State Department of Health, and the University of Hawaii Office of Public Health Studies, Hawai'i Health Data Warehouse. The Hawaii Oral Health Coalition seeks to work collaboratively to exchange mutually beneficial resources and to direct change at multiple levels through advocacy, improved access, education, workforce development, and oral health surveillance. With local coalitions on Hawaii Island, Hawaii, and Maui, they strive to lift up all voices in the call for a healthier Hawaii. The Oral Health Data Tracker is a new tool on Hawai'i Health Matters that aims to monitor the burden of oral disease in Hawaii, the use of the oral health care delivery system, and the status of preventive interventions, including regular dental care and things like community water fluoridation. Overall, it is a convenient tool to monitor the oral health of the state. Currently, it houses 30 indicators of population health from multiple data sources, including the Behavioral Risk Factor Surveillance System, or BRFIS, the Youth Risk Behavior System, or URBIS, the Pregnancy Risk Assessment Monitoring System, or PRAMS, and the National Survey of Children's Health, NSCH, and MedQuest and Head Start. The tracker is divided into sections to make it easier to find your area of interest, and more indicators will be added soon from the 2020 PRAMS and MedQuest. The tracker features a toggle control to let you easily see data by state and county level, trend data, subgroup breakout data such as by sex or race ethnicity, and others where available, icons to highlight comparison data and directionality, interactive maps and charts, and links to related data. As with all our systems, data are updated asynchronously by source. There are many new indicators in the Oral Health Data Tracker. Here are some of the new childhood indicators we've created. These top 3 are from the National Survey of Children's Health. And additional child data came from the Head Start program, an educational program of the United States Department of Health and Human Services for low-income families. These indicators are important because they provide information on children at risk for oral health problems. And here we have the data for the EPSDT enrolled children. The Early and Periodic Screening Diagnostic Treatment, or EPSDT benefit of Medicaid, provides comprehensive and preventive healthcare services for children under 21. EPSDT is key to ensuring that children and adolescents receive appropriate preventive, dental, mental health, and developmental and specialty services. Here you can see the oral health indicators we made from the available data. We also took advantage of this opportunity to create several oral health indicators from the Pregnancy Risk Assessment Monitoring System, or PRAMS. Caring for one's oral health during pregnancy is an important step in ensuring a healthy birth. The indicators here measure both knowledge and action as it relates to oral health during pregnancy. The first 5 are already located in the tracker, and the last 3 will be added once we have the PRAMS 2020 data ready to load into the warehouse, which will be happening later this summer. Last, here are our future indicators from MedQuest. These look at the number and proportion of dentists enrolled in Medicaid with claims, as well as air transport for dental services. And DOH is in the process of acquiring this data. 2 of the guiding principles of Hawai'i Health Matters are to provide data in context, so you have something to compare it to, and to make data easy to understand. We do this by using a collection of symbols and visual cues throughout the site. Up and down arrows are paired with colors, so the color red is bad or moving in the wrong direction. Green is good or moving in the desired direction, and blue is neutral. For symbols, solid trend boxes are statistically significant, and mostly white boxes are not statistically significant. A green check means a target has been met, and a red X means that it has not been met. Let's work through an example. Here you can see that 75.3% of adults in Hawaii visited a dentist in the past year. This is higher than the median value for states and territories, which is 67.6%, but about the same as the prior year. It's significantly trending upward, which is good, and we've met the Healthy People 2030 target value of 45%. Among adults in Hawaii, 41.3 have had one or more tooth extractions. This is equal to the median value for states and territories, about the same as the prior value, and trending down, which is good. Here, there's no HP 2030 target. Let's go ahead and go to the live site. You can get there directly through Hawai'i Health Matters, or if you're at HHDW, you can use this panel on the left to get to Hawai'i Health Matters. Once you get there, you can see that the oral health tracker is the featured content this month. You can click on the tile to access the tracker. Also, you can scroll down and find more information on our Focus On mini dashboard. This dashboard changes monthly, and it highlights information in HHM related to the featured content of the month. You can see here we have 4 indicators from the oral health tracker with icons or point prevalence. The focus tile will also take you to the tracker. However, all this will come change July, so you can also find the tracker through this Find Data tab under the Community Dashboard. And the tracker shows up here. Or if you'd like to see all of our trackers, you can go to this Track Progress button and see that the oral health tracker is the first one because it is our newest. So here you can see the homepage for the oral health tracker. We provide a bit of background information and a summary of the tracker. The data is broken down into among children, during pregnancy, among adults, priority populations MedQuest children, priority populations Head Start children, community supports, oral health providers, and emergency dental visits. For each indicator, you can see the point prevalence, the year of measurement, and the comparison data. So the dentist rate was last measured in 2019 at 90 dentists per 100,000 population. We're doing better than the most recent US value of 68 in 2017, and we have increased from our prior value. Lastly, we are trending up in a statistically significant manner. Now back to the top of the tracker, I wanted to bring your attention to these controls, which allow you to view the indicators in tile sets, such as these. Here you can also turn on the colorblind mode, which adds these little thumbs up and thumbs down to the icons. The drop-down menu allows you to change the geography of the tracker. We're currently looking at the data for the state of Hawaii, but if I'm from Maui County, I may be more interested in my local data. So I can pick my county, and then the tracker will adjust to show the data for Maui, and the Hawaii state value will appear as one of the comparison values. You may have noticed that several of the indicators are no longer present in the tracker, and this is because those measures aren't available at the county level. Several of the data sources in this tracker only provide data at the state level, so they will not show up when we're looking at Maui County. Let's take a closer look at one of the indicators. Here we can see the name of the indicator, adults 65 plus with total tooth loss. Below the name are the controls which allow you to select the geography. I'm going to go ahead and select state again, and the measurement period, which we'll leave at 2018. Next, you can see how this indicator is defined. It's the percent of adults age 65 and older who have had all their natural teeth extracted. Here you can also see a brief explanation of why this indicator is important. And scrolling down, we can see the point prevalence, the data source, and the year, and the contextual icons that help us interpret if 6.2 is good or bad. If you don't remember how to interpret the icons, you can mouse over them for more information. There's also a handy legend here on the left that you can always refer to in order to refresh your memory on the meaning of the different icons. So here we can see a line graph showing change over time, as well as breakout data. We can hover over the graph to see the underlying data. We can also click on these 3 bars we affectionately call the hamburger to see that we can adjust the chart options and export the graph as a JPEG, PDF, or download the summary data as a CSV file. As we examine the subgroup data, you can see that the data in red is significantly worse than the data overall, and the data in green is significantly better. Here we can see that total tooth loss is significantly higher among adults at 0 to 130% of federal poverty level, and significantly lower among those with a higher outcome. Next, we can explore the data by geography. For this indicator, the data is available by state, county, census place, zip code, and census tract. And note that you can download the data here in a CSV file as well. Let's take a look at the data by county. Now we can see here that Hawaii County has a higher rate of total tooth loss than the state as a whole. We can further break down the data by looking at a finer geographic level, let's say zip code. And here too, we can use comparison values. So I'm going to look at the Hawaii zip codes. And now you can begin to get an idea of the specific areas that have high rates of toothlessness. The final part of the data in context is that each indicator is displayed with related content, including indicators, reports, data resources, fact sheets, plans, articles, and infographics. We can load associated content into the platform and associate them to health indicators via keywords. So here you can see other indicators related to oral health, as well as oral health reports and fact sheets. If this indicator information isn't quite enough, or you want to view it in a different way, perhaps by 2 dimensions, by age and sex, for example, then for indicator data that is housed within the Hawai'i Health Data Warehouse, such as BRFIS, you can click on the data source and go to the HHDW indicator-based information system, or Hawaii IBIS, which is another tool that allows users to run real-time queries on the underlying BRFIS data set. For more information on how to conduct your own searches on Hawaii IBIS, check out our other coffee break webinars on YouTube. We're going to do a little activity, but before we do that, I just wanted to invite you to join us for next month for the HHDW coffee break, which will be on the 2020 BRFIS data release. Be sure to check back on the oral health tracker in the future when our BRFIS indicators are updated and when our new PRAMS indicators are added. Now let's give you time for some hands-on work. Take a few minutes to explore the tracker and answer these questions. All right, let's review the answers for our activity. What is the highest dental hygienist rate we've seen in Hawaii? That would be 68.7 per 100,000, and that was in 2020 to 21. Which county has the lowest rate of adults who visited a dentist in the past year? We saw that already. That was Hawaii County, but extra points for if you actually went and got the value of 66.3. And what is the HP 2030 target for pregnant women with dental insurance, and has Hawaii met it? It's 59.8%, and yes, we have met it. So again, please join us next month, Tuesday, July 5th at 11 a.m. It'll be on the BRFIS 2020 data release. And thank you again for joining us today. If you have any questions, please feel free to email us. We would love to help.